Hi, Coda Ramos. I'm going to be doing my NG tube skill. If you can do a pan around the room. This is Brandon. Just really upset. We'll get these over here. Put these away. So, Brandon's going to be my volunteer. So when I first go into his room, I'm going to identify the patient in two ways. We have Jaguar J. Jones, MR number 4176352, 4176352. Assess his allergies, he's allergic to penicillin, and he's allergic to penicillin. Then I'm going to explain the procedure to him. So today we're going to be putting an NG tube, a nasogastric tube, into your nose. It's going to go into your stomach. After I explain the procedure, I'm going to go ahead and wash my hands, position my trash can, and wash my hands. After I wash my hands, I'm going to gather all my supplies. After I gather my supplies, I have my 60 milliliter syringe, my Salem slump, because that's the one that we will be using today, because it's going to fit into his nose, 2 alcohol prep pads, my lubrication, my O2, which I'm actually just going to put on his finger right now, a couple clean pairs of gloves, and my goggles. Then I'm going to put my goggles on, but I'm not going to put them on. I'm going to keep them on because I have my glasses on today. And I have my pen light in my pocket and my stethoscope. I also have my towel right here and my emesis basin right here. So now I'm going to put my goggles on and we're going to establish a Q sign. So a Q sign is in case it starts to hurt really bad or you just need to take it out. I'm putting it in, so our Q sign will be whatever, hi. After we establish our Q sign, I'm going to assess his bowel. I'm going to assess his bowel sounds. So I put the O2 sound on and I'm going to assess the bowel sounds. And when I'm assessing the bowel sounds, I would do it underneath clothes. I would pull his gown up. We're not going to do that today, so it's just going to be, I would just assess like around here. So now, what I'm going to do is I'm going to put on clean gloves, and I have my goggles on, and I'm going to lubricate my Salem slump. So I'm going to open it up, take my lube, and put it in the packet. Gross. Throw that away, open this up, and I would lubricate about 4 to 6 inches of the tube. So, fake lubed it, it's lubed up, it'll be ready. So now what I'm gonna do is I'm gonna measure it. So when I'm measuring it, it's gonna go from his earlobe, his nose to his earlobe, just like this. And then it's going to go to his xiphoid process. So it's going to go here to his xiphoid process. So this is what it's going to be. And I have my tape as well. And I'm going to dog ear my tape, which I already have. And I'm going to put it on the tube. After I dog ear it, I have this coiled up and I will dog ear it. And it'll be ready. Okay. You're good. You can leave now. Thanks. So now we're gonna move. Now we're gonna move to. You can come over here, Carly. We're going to move to our stimulated patient. So with our stimulated patient, I'm going to start here, and I'm going to put a towel down on his chest. This is going to be his towel. And we're going to assess our patency. So what I would have you do, cover one nostril. We use this one, but we're going to use his right one. So what I'm going to do is I'm going to start inserting it. So it's already lubed up. So it's gonna go in, put this in the basin. It's gonna go in, and what I'm gonna do is I'm gonna have the cup of water right here next to him so he can drink. And he's gonna either swallow or dry swallow. And I'm gonna go in a little bit, face going towards the ear, and I'm gonna go in and push and rotate 180 degrees. I'm hitting the thing that's inside there. I'm gonna push and go 180 degrees, and I'm gonna encourage him to swallow the water or dry swallow, and I'm gonna go all the way until I get to my dog ears. And I'm gonna stop if he is coughing or if his O2 sat. This right here, if his O2 sat drops, and I'm gonna stop and go to the posterior nasopharynx. I'm gonna go all the way in. Being 11:23, so I'm gonna keep going. I'm gonna go slower, but gonna go to this right here. Then what we're gonna do is we're gonna take our temporary. What we're gonna do is we're gonna hold on to it so it doesn't fall out. Take our temporary tape and we're gonna tape it to his cheek. If I tape it to the paper, it's gonna, whatever. Tape it to his cheek. And we're gonna do that. And now what we're gonna do is we are going to assess that it is in the right spot. So we're gonna do that by checking for an x-ray, checking by x-ray, checking the pH if indicated, and then also if he's aspirating in here, aspirating any gastric contents. So we're gonna do that, check that, and now what we're gonna do is we're gonna hook him up to suction, and we're gonna clip it to his gown, hook it up to any suction, so we're gonna put it in this way. Suction goes in here, and we're gonna make sure that's above him. So when it's above him, gonna hook it up. Excuse me. Whew. Just gonna say it's above. And then now what we're gonna do is we're going to do our final tape. With our final tape, we should have done this earlier and do the temporary. We're gonna take another one, do it like this, and then we're going to hook it right here onto his nose. Then what we're going to do is we're going to take this off, like this. See how those go. And then what we're gonna do is we're going to put it on like this, just like that. So it's our final tape, and then we're going to have the date and time on this one and put it on the bridge of his nose. So now he's got it in, and he's got it connected to suction if it needs it, or if he doesn't need it, it's gonna make sure that it's sitting above his nose so it doesn't keep leaking. So now what we're gonna do is we're gonna remove it. So when we're removing it, I didn't even connect it to this. This is when we do one of these. This is just not going very well. It would be connected to this in here, like this. And when you aspirate your gastric, your gastric juices. But we're gonna leave that in there, and we're gonna put it up here. This is above his shoulder. And then what we're gonna do when we're done here is we're going to put his bed back down, no lower than 30 degrees, take off our gloves and document. Now when you document, you're gonna document the type of tube and the size, the time that you put it in. Then you're also gonna document a lot of other things that I don't remember. The time, the type of tube, Salem sump. Then you're gonna document, I think, the gastric things that come out, the gastric juices. And then also how the patient tolerated it, and the O2 levels. Then we're gonna take it out. So when you take it out, we're gonna disconnect it from the suction. We're gonna put it in the basin. So now, this is gonna be so bad. Now, what we're gonna do is just gonna disconnect it. And when I'm taking it out, I'm gonna take it out slowly and rotating it, but I'm gonna have them like bear down. So, yeah. So I'm just gonna take it out, like bear down, they're breathing like one of those kind of things. Take it out. Put it in the basin. Put it away. After you take it out, I'm not really sure what you do. After you take it out, you'll probably just document, take your gloves off, document. I'm not sure what you're documenting, but